नमस्ते अभिषेक सर। मैं आपका प्लैनेट ऑफ द में स्वागत करता हूँ। जैसे कि आज आप आए हैं प्लैनेट ऑफ द सेंटर में, सर मैं आपसे जानना चाहूँगा कि यहाँ से जो ट्रीटमेंट चल रहा है, पेशेंट का नाम क्या है और कौन है वो पेशेंट।
So the patient is father of my friend, and they live in Meghalaya, which is a far northeastern state. Patient is very old, 70 years, and he suffers from fourth stage liver cirrhosis and multiple myeloma, which is a kind of a blood cancer. Uh, and since they can't come here, so I was helping them, being the bridge between the doctor and the patient.
जी।
So I basically, so my friend discovered Dr. Vikram because he's very renowned and specialist in Ayurveda for liver diseases and blood cancer diseases. So, well, we thought why not take an opinion from him. So I took the reports to doctor, and the reports had shown that he had fourth stage liver cirrhosis and multiple myeloma, which is a very grave disease, and allopathy I don't think so has any solution to it. And her father was completely on chemotherapy, and I don't think so anything good was happening through that. But then we took a medicine, a 1 month medicine from Dr. Vikram, which he gave me, and we couriered all the medicines to Meghalaya. They have an in-house courier facility, so basically there was no hassle for me. They packed themselves and sent it to Meghalaya, and she used the medicines for her father for almost a month, and then we did another biopsies and another report, and it was really a miracle that has come out. There is no more multiple myeloma band in the blood report, which is like, even the doctors there, when they went for the checkup again, they were also like kind of, how has this happened. And plus there is a lot of improvement in the liver also. There is no water in the lungs. There is a lot of other things has improved. So I think this is really amazing how Ayurveda has incredibly, it's a gift of our ancient wisdom that has come to us. And doctors like Dr. Vikram are really the pioneers and the torch bearers of Ayurveda. In this current capitalist economy where allopathy and big pharma has taken over, doctors like Dr. Vikram Chauhan are really making their effort to still exercise and practice the authenticity of Ayurveda. So this is really incredible. I really commend doctor's job, and I think this is more people should know about what Planet Ayurveda is doing, and should switch from allopathy to Ayurveda, because it is really very efficient. And another big plus point of Ayurveda is that it is very non-interfering. So it is like food. So it's basically it's just basic herbs. So they don't interfere with your existing process. They basically facilitate it to become more harmonious. So that's why you can even take that medicine with allopathy. And I proudly say that my friend's dad, he's off chemotherapy now for almost 3 months, and we are going to go for another report after 3 months, and we continue to take the medicine, and we look forward for good recovery for her father.
सर जो ये मल्टीपल माइलोमा है, ये डायग्नोज कब हुआ था?
This got diagnosed last year, early last year, around I think April, May, and it is such a disease that as soon as doctors get to know about it, they immediately recommend that you should go for immediate chemotherapy. And patients, since it's such a popular and such a scary disease, that patients are really left with no choice but to go for chemotherapy. And so that's what was the case in my friend's dad.
मैं भी व्यूअर्स को ये बताना चाहूँगा कि जो आपके नॉन में हैं जिनका नाम है सिंडोला, तो उन्हें मल्टीपल माइलोमा था, जो कि एक बोन मैरो कैंसर होता है एक तरह का ना। तो उसमें क्या होता है कि आरबीसी लेवल, डब्ल्यूबीसी लेवल और प्लेटलेट्स, इनका जो लेवल्स है ये रिड्यूस होना शुरू हो जाता है, क्योंकि नहीं बनता है तो ये रिड्यूस हो जाते हैं। और इसे डायग्नोज करने के लिए एम बैंड का जो टेस्ट है वो किया जाता है। तो उनकी रिपोर्ट्स भी हैं आपके पास, मैं व्यूअर्स को दिखाना चाहूँगा इस वीडियो के माध्यम से। सर दिखा दीजिए रिपोर्ट्स।
ये पुरानी रिपोर्ट्स हैं। ये मैं आपको एम बैंड की रिपोर्ट दिखाता हूँ। ये देखिए एम बैंड यहाँ पे डिटेक्ट हुआ है और यहाँ पे लिखा हुआ है माइलोमा बैंड डिटेक्टेड। और ये रिपोर्ट जो है वो है 5 मई 2018 की।
ठीक है सर।
और मैं अब आपको रिपोर्ट दिखाना चाहूँगा लेटेस्ट एम बैंड की। ये रही ये रिपोर्ट है 11 जनवरी 2018 की। नहीं ये गलत चला हुआ है इसमें, ये 2019 की है रिपोर्ट।
ठीक है।
ये वाली। और इसमें बेसिकली नो एम बैंड डिटेक्टेड है।
ठीक।
ये 11 जनवरी की नहीं है, ये एक्चुअली में डेट गलत है, ये 1 नवंबर की है ये।
हाँ जी।
ठीक है।
ठीक है।
तो ये मई की थी, ये थी 5 मई की, और ये है 11 नवंबर की, 1 नवंबर की।
ठीक है सर।
और यहाँ पे देखिए अब नो एम बैंड डिटेक्टेड है क्लियरली। बहुत ही ये जो एम स्पाइक है वो ख़त्म हो गया है। तो दिस इज़ अ रियली विच आई मीन इन अ डॉक्टर्स वर्ड, डॉक्टर्स लैंग्वेज इट इज़ अ मिरेकल। नॉट इन डॉक्टर्स लैंग्वेज, आई थिंक फॉर एवरीवन दिस इज़ अ मिरेकल। सो वेल, गुड जॉब।
सर जो पेशेंट थे उन्हें मल्टीपल माइलोमा तो था ही, साथ में लीवर फेलियर भी था, तो उसमें कितना इम्प्रूवमेंट मिला है?
The doctor's advice basically for liver transplant, and this was the last resort that we took. And if you can see, basically there is this is the report from 7th May 2018, which says basically there is minimal ascites and bilateral pleural effusion, जो lungs में पानी भर जाता है। And in this report, this is on 6 to 6 फरवरी 2019 की, is basically no basically pleural effusion has been seen, मतलब वो पानी ख़त्म हो गया है। No active lung lesion has seen, so which is basically huge improvement। और जब I think ये भी बहुत रेयर है जहाँ पे when doctors recommend for liver transplant, but this is like coming back from coming back to life। जिस स्टेज पे अंकल थे, this is a stage which normally in allopathy they say basically it's a dead liver, you have to change the liver, but to see such reports, these are coming from the same liver, which is basically it has sprouted back to life, so which is incredible।
ठीक है सर, हमारे जो व्यूअर्स हैं वो इस वीडियो को देख रहे हैं, उन्हें आप क्या मैसेज देना चाहेंगे इस वीडियो के माध्यम से?
I think I've already shared my message, but again I would like to emphasize that Ayurveda is a gift of our ancient wisdom, and we are so lucky that it originated from our country, and there is so much access available to it, and doctors like Dr. Vikram are actually the torchbearers who are bringing it forward to people। So people should definitely go for Ayurveda before they decide to go for allopathy, and also since they don't interfere in allopathy medicine, so if you want you can still continue your allopathy treatment, but at the long side you can also have an Ayurvedic treatment। But this is my friend's dad, they were also taking allopathy and this, but after some time when they took these tests in November, the reports were so good because the myeloma was not there anymore, so they completely stopped the allopathy and chemotherapy, and they just stayed on Ayurveda। So this is
ठीक है। थैंक यू सर फॉर कमिंग एट प्लैनेट ऑफ द सेंटर, और आपने व्यूअर्स को हमारे इतनी अच्छी इन्फॉर्मेशन दी। थैंक यू सो मच।